Hi, my name is Subir Batra. I'm the CEO of Quorit Wound Care. We are today sitting at IPA Con 2024, the Indian Podiatric Association conference at Hyderabad for the state of AP and Telangana. I have with me Dr. Shailesh Chhotala, who is the president of the IPA in Gujarat, and he's one of the leading practitioners of in the field of podiatry in Gujarat and also in the entire state, in the entire country, and he has also taken the additional initiative of providing proper offloading to patients with podiatric problems, and he has his own company called Foot First. Sir, why don't you just tell us a little bit about yourself, and after that we'll talk about IPA a little bit.
Okay. Yeah, as you said, as a president of Gujarat Indian Podiatry chapter, I'm working with the diabetic foot patient as well as some orthopedic foot problems. And I found diabetic foot is emerging nowadays. And as you said, I mean, we developed the offloading devices in terms of footwear, in terms of shoe as well. So lots of choices nowadays with us to, I mean, treat the proper way to the diabetic foot patients. And meanwhile, lots of adjacent therapies we are using along with the footwear and some surgical aspect also. We are dealing with the diabetic foot. So yes, diabetic foot, I mean, it's a very burning problem nowadays with the people with diabetes. So yeah, we address this diabetic foot in many ways. We are treating diabetic, and our main goal of the Indian Podiatry Association is IPA. It means the I prevent amputation. So it's a national slogan given by Dr. APS Suri sir. So yeah, we are working with the same aim and same goal nationwide. So as a head of Gujarat IPA chapter, we also dedicatedly working with the same aim, I prevent amputation.
So this is a very, very apt slogan that you've come up with, the tagline for I prevent amputation. Because as per research, I don't think too many people know this, that worldwide there are about one amputation every 2-3 minutes.
True.
And a large number of these amputations are preventable.
Yeah.
The problem is there's not enough awareness about the treatability of conditions which finally lead to this kind of, and I think IPA is playing a very, very active role
Yes.
in this field, and Dr. Chhotala is one of the most active participants in this whole progress. So can you just tell us a little bit about IPA and what IPA is doing and how IPA is helping in overcoming this problem that is plaguing the country and also the world?
Yeah. Dr. A.P. Suri sir taken initiatives with the very early time in the diabetes era. So maybe I think 15 years back or more than that, they started the Indian Podiatry Association started with the Delhi, and then slowly they comes up with the statewide chapters, and nowadays IPA has nationwide state chapters are very, I mean, the big states have its own Indian Podiatry Association chapter. So Dr. A.P. Suri, I mean, he, I mean, started, and he aimed to prevent amputation with the initial stage. So in every aspect, so in whole world, whatever update in the diabetic foot treatments, Dr. A.P. Suri always comes with the a good idea and good projection in the Indian scenario of diabetic foot of treatment. So he aimed and he lived with the same goal, and he, as I said, initiated, and he is right now father of diabetic foot in
And
India.
I can see that.
Yeah.
I can see that, and he's still very, very active, and you are
Yes.
very, very active in this. So that is great news for the country. I think over a period of time we will be able to save a lot of limbs
Yeah.
in the coming years. At Quorit, and let me tell you this also, we've established a Quorit Academic Foundation.
Wow.
The aim of that academic association is threefold. One is to spread awareness about the
It's very
condition
important.
that is very, very important. I think IPA is also doing a great job, but I think a lot more collaboration is required. More people have to come in. India is a
reach
very
out.
big
Yeah.
country. The second we're doing is we are imparting training. So we have started the process. We're tying up with institutions, medical universities, and the like, and we're talking. Obviously we're working with IPA also here to impart training to practitioners.
Yeah, it's very important part.
Because again, the issue is unless more and more doctors get involved in this area, awareness is just a first
Right,
step.
yeah.
So you need the second step also. And the third that we're doing is we are starting research, research into new products, new molecules. From an Indian perspective, today whatever is available in India today for treatment is primarily something that has either been imported from the West or copied from the West, and all the research has happened in the Western countries.
West countries,
So we
mostly.
realize there is a need for India to come up in this field. So that is something that we're doing. We are also I think I discussed with you also sometime. We have created a mobile app, the Quorit Wound Management app. The objective of that is to ensure proper analysis and assessment of wounds first through a standardized protocol, capturing objective parameters which can be used to monitor the wound progress, help collaboration within doctors. See, what happens today is that you as a doctor might be treating someone else might be treating someone, but there's a lot of sharing of knowledge that needs to happen. There has to be, sometimes some difficult cases you want to discuss with, let's say, Dr. Suri, so you can share the data through that and discuss with him. So a lot of this monitoring, sharing with patients, so the patient don't know if the wound is healing or not healing initially. It takes time. So sharing of objective data. So we are also doing our little bit towards this. What is your
Yeah,
thought
actually,
about this?
that is very important point, because in each and every part of the India, everybody is trying to treat the patient prevent the amputation, but at the same time, they are looking for the early healing.
Yes.
So if awareness is good, by any way by Quorit or any institution collaboration, so or even in association collaboration, the main aim is to prevent amputation. So early stages, they if they know, the practitioner know, then they can teach to patient and they can guide the patient to not went into the advanced stage of the amputation.
Yes. See,
So
for example, what happens is a patient comes to a general practitioner, let's say, and that is where it stops. A lot of time they don't know. They suggest very
what to do and what not to
they
do
don't
at
know.
this stage.
So if they share that with you through the app and you guide them,
Yeah.
and you collaborate with them, discussion. One thing that happens is the patient gets treated much better. Second, that doctor also starts learning. He sees how the treatment. So next time he can use similar techniques for
Yeah,
himself.
so right time, right decision. It is main aim to, build this app or any other way. The decision making is because in diabetic foot or even in any wound, time is the tissue. So if time is, if even any waste by any patient or even in any health practitioner, then patient has to suffer to land into the amputation. So time is the tissue.
Yeah.
This is the
And for
important
this,
motto.
I think industry and doctors and doctor associations have to work together.
Work together.
To get this, and that is a very good initiative of IPA. I can see behind you. You have the most leading practitioners
Come together on a single
on a
platform.
single platform,
To
and
treat
you
the
have
diabetic
companies
foot.
also that have come here for supporting. And this is how there's a lot of training being imparted, live workshops happening, and this is a wonderful platform to ensure.
Today, me and Dr. Suri sir also doing live workshop for
Exactly.
diabetic, but how to, the freshers, PG or any freshers doctors, so they can start little with this thing, and they can put their role into prevent amputation.
And this is good that you mentioned freshers and PG students who are coming up, new doctors. What is your advice? You've been practicing this for a long time. You have gained a lot of expertise in this. You've treated so many patients. I know for a fact that you've treated so many patients. I've seen that, great reviews. So, what is your advice to them when they're coming into this field?
I think like Dr. Suri sir, I started my career with the after getting the fellowship from Dr. Suri. we started a little bit the careless con, and that led into the ulcers, and we treated with the lot more advanced modalities. So we comes up with the basics, then we started advanced, and now we got the good workshops.
And
Nowadays
I think
rolling with the
you're
IPA.
also training people at your hospital, training
Yes,
fresh doctors
yes.
at your hospital.
Yes, 120 doctors selected for 4 modules of diabetic foot in this coming March.
And that is something
So that is
that we
something,
need as a
yes.
country. We need. This is a great social cause. Thank you so much for talking to us, taking out the time from this schedule. Thank you so much.
Thank you.
Little pleasure talking to
Thank
you.
you. Great.